Hi, I'm Anna Runkle, also known as the Crappy Childhood Fairy, and I teach people how to recognize and start healing the symptoms of childhood PTSD. But today I want to talk about this idea that so many people are walking around with a, quote, chemical imbalance in their brains. And it's an imbalance that in many, if not most cases, is treated with medication like antidepressants and anti-anxiety drugs. In the US where I live, more than 1 in 6 people take psychoactive drugs like these, and it's 1 in 4 among women my age. And even little kids are being medicated on a big scale, more than 10% of them. Now, I'm not a scientist or a therapist or a doctor, and I do know that for some people, medication has been incredibly helpful and even life-saving. But this many people taking that many drugs, is that really necessary? And for people who had childhood trauma, does this chemical imbalance theory even connect with why we often struggle with depression and anxiety? From the research I've studied, and experts debate it, but medication is probably not a panacea for the symptoms of childhood PTSD. And some people might need it, but not everyone, especially given that there are other, simpler, cheaper, non-mind-altering, and quite possibly more effective means to get your brain back into a regulated state. And it seems to me that everyone who is dealing with the effect of trauma in their past maybe should be learning and trying these measures, because what the underlying cause is very likely to be is brain dysregulation. So when your brain is regulated, no stress, you're functioning well, and if you were to look at your brain waves, they'd be flowing along with regularity and with some synchrony between waves that come from different parts of your brain. You'll also see that heart rate and breathing, which normally go up and down together, you breathe in, heart rate goes up slightly, you breathe out, it slows down slightly. But when a person gets startled, for example, like they almost get hit by a car or something, those waves can get momentarily very chaotic, and there'd be a whole endocrine response with adrenaline and so on. And then gradually, after the crisis had passed, a normal person would just calm back down again. The waves would go back into their pattern again, the heart and respiration would go back into their pattern, and all would be well. But for people with childhood PTSD, that chaos state can get triggered by just little things, or even nothing. And so it's happening more often, and it's lasting longer than it would in normal people. So everybody eventually re-regulates sometimes, and even we with childhood PTSD, we can re-regulate spontaneously. But that history of trauma can make it hard to control when it happens and how quickly it happens. And the problem with all that time spent dysregulated is that's when the bad stuff is likely to happen. Not only can dysregulation bring on a spaced out feeling, it can wreck our ability to focus, it can throw our emotions into turmoil, but it can also create chaos in our body systems, the nervous system, the endocrine system, the immune system, for example. And when these become dysregulated, there's kind of an opening for illness to grab hold. Things like high blood pressure, autoimmune disease, heart disease, diabetes, and even cancer. These happen at much higher rates for people who experience trauma as kids. And the more trauma there was, the higher the likelihood that these illnesses will occur. Now, dysregulation is obviously not the only thing going on with childhood PTSD, but it's significant. And I'd say we should probably be taking it pretty seriously, right? If you could learn to re-regulate, that would be important, because dysregulation is not necessarily something that responds to medication, and even therapy is not always a fit. And trying to talk about problems when we're dysregulated can actually be flat out triggering, and that can block any ability to listen or analyze or remember whatever good ideas happened in therapy. So yeah, 1 in 7 people will take drugs like antidepressants and anti-anxiety meds this year, and the use of those drugs keeps going up, and the rates of depression and anxiety keep going up too. So instead of jumping right into therapy and meds, what some of us are doing is focusing not on brain chemistry, but on brain re-regulation. Strictly speaking, there is, of course, a chemical component with anything going on with your body, including brain regulation. But you can actually learn to re-regulate your brain using simpler, safer, self-administered techniques to re-regulate. And this can be helpful on top of traditional treatments, or in many cases, all by themselves. Now, again, I want to acknowledge that some people really do have serious depression, anxiety, and other mental health problems, and that medication can be life-changing and life-saving. I know many such people, and I respect the way that they're caring for themselves. All the same, I question whether this epidemic use of psychiatric drugs and the thinking that goes into prescribing them to so many people is actually positive on the whole. Because it seems to me that such a large number of people who are being offered medication and maybe therapy, but few other options for feeling better, that pattern is bound to influence us collectively. And I think it is influencing us. It affects our understanding of why we get depressed or anxious, and more importantly, what to do about it. If we jump to the conclusion that it's a chemical imbalance and so therefore pills, we skip over a lot of other ways that trauma can make life fraught for us. Maybe the problem has more to do with guilt and shame we're carrying around, or anger, or a sense of isolation. And all of this can get way out of proportion for people with childhood PTSD. And sometimes we're having those reactions for a good reason. Maybe there's something we want to clear up from the past. Maybe we want to make an apology or make a boundary or just make things different going forward. That's not a chemical imbalance. But if we keep having the negative emotions and never do anything about them, it could sure look like a chemical imbalance. When life gets hard and somebody offers a solution, any solution, it's tempting to believe whatever they say. So if you're experiencing depression and anxiety and what you're already trying isn't helping, maybe try a new approach, something that you control, something you can use whenever you feel upset or dysregulated to start to learn to re-regulate and see if that helps. In my case, it was like night and day. And when you're re-regulated, it's a heck of a lot easier to make positive changes. You can speak up and express yourself. You can leave a bad relationship. You can listen to people. You can plan. You can take care of your health, and you can connect with people. And you can ask for more help. It's win-win when you learn to re-regulate, so you might as well give it a try. In my next video, I'll talk about ways that you can tell if you're dysregulated, and I'll give you a whole handful of easy techniques you can use to start re-regulating right away. And I think you'll like this. So if you want to be sure to see that next video, be sure you subscribe and you'll get a notification when it comes out.